In this video, we're going to look at the League of Nations humanitarian work during the 1920s and the 1930s. When people think about the League of Nations, they often focus on whether it kept peace between countries. But the League also tried to solve major humanitarian problems. These were problems affecting ordinary people's lives, such as refugees, disease, working conditions, and slavery. This matters because, in some areas, the League of Nations had real successes. In fact, some of its humanitarian work was among its greatest achievements. In this video, we're going to look at 4 areas. First, refugees. Second, health. Third, working conditions. And finally, slavery. First, let's look at the League's work with refugees. After the First World War, there were huge numbers of people who had been displaced. Many former prisoners of war were stranded in different countries, especially in Soviet Russia, Poland, France, Germany and Turkey. There were around 250,000 Russians in German or French camps and around 300,000 Germans and former Austro-Hungarians in Soviet Russia. On top of this, more than 1 million Greeks were made homeless during the Turkish War of Independence, which lasted from 1919 to 1923. The League gave responsibility for dealing with this problem to Nansen. He was a Norwegian explorer and scientist. This was a huge challenge. The League had a very small budget, but Nansen and his staff worked with the Red Cross to help displaced people. Between 1920 and 1922, they helped around 425,000 displaced people, either to return to their homes or find new homes. Nansen's work involved lots of practical solutions. His team helped find suitable transport, set up camps, create new settlements, teach new trades and skills, and issue identity documents. This was one of the League's clear humanitarian successes. It was a logistical achievement, and the League received praise and thanks for its work. So, when judging the League's work with refugees, the overall judgment is positive. The League faced a massive problem, had limited resources, but still helped hundreds of thousands of people. The second area was health. The League's health organisation is often regarded as one of the most successful agencies. One reason it was important was that it worked beyond the League's own membership. It created links with non-member countries, including Germany, Soviet Russia, and the USA. Its aim was to provide information, technical assistance, and advice on public health. One example of its work was in Soviet Russia, where it helped prevent a typhus epidemic in Siberia. It did this partly by organising a public education campaign on health and sanitation. Another important part of its work was its campaign against mosquitoes. By trying to exterminate mosquitoes, the health organisation aimed to reduce the spread of malaria and yellow fever. The health organisation was also involved in setting up research institutions in London, Copenhagen and Singapore. These institutions helped develop internationally accepted vaccines for diseases such as diphtheria and tuberculosis. This shows that the health organisation was not just reacting to individual crises, it was also trying to create international cooperation in public health. Its success was later shown by the fact that after the League ended, its work continued through the World Health Organisation, which became connected to the United Nations. So, the League's work on health could be seen as one of its strongest achievements. The third area was working conditions. This work was carried out by the International Labour Organisation, often shortened to the ILO. The ILO's main aim was to improve working conditions around the world. It collected data on employment practices, published its findings, and tried to persuade governments to take actions by issuing recommendations. These recommendations included an 8-hour working day, a 48-hour working week, annual holidays with pay, the right to join trade unions, and a minimum employment age. The ILO also published information about health and safety in the workplace. For example, it showed that the use of white lead in print manufacturing was dangerous to health. However, there were limits to what the ILO could achieve. Different countries did not always implement its recommendations. The response from governments was patchy. For example, the ILO recommended the minimum age for employment should be 15, but even in Britain, the school leaving age was not yet raised to that level until after the Second World War. In the USA, some employers were still denying workers the right to join trade unions well into the 1930s. So, the ILO had some success, but it could not force every country to follow its recommendations. However, it did help establish and popularise new benchmarks for worker and employment. These included ideas about working hours, minimum wages, sickness and unemployment insurance, and pensions. This means the ILO helped make it harder for member states to ignore improved working practices. So, the League's work on working conditions was partly successful. It changed expectations and set standards, but implementation varied between countries. The fourth area was slavery. The League's Slavery Commission aimed to stamp out slavery and slave dealing. It also tried to deal with other exploitative practices, including forcing young women and children into prostitution, known as the white slave traffic. The Slavery Commission used methods such as persistent inquiry, publishing reports, and repeatedly encouraging governments to take action when they seemed slow or evasive. There were some clear successes. The Commission helped free 200,000 slaves in Sierra Leone. It also helped reduce the death rate for African workers in the railway from 50% to 4%. And a number of countries also abolished slavery altogether, including Iraq, Jordan, and Nepal. However, the success was not complete. Slave trading still existed, and this was acknowledged by the Commission's report for 1937. The white slave traffic also remained a serious social problem. So, the League's work against slavery had important successes, but it did not completely solve the problem. So, how successful was the League's humanitarian work? Overall, this was one of the more successful areas of any of the League's work. The refugee organisation helped 425,000 displaced people either return home or find new homes between 1920 and 1922. The health organisation helped prevent disease, supported public health campaigns, and contributed towards vaccine development. The International Labour Organization helped create new standards for working conditions, even though not all countries followed them. And the Slavery Commission helped free slaves, reduce exploitation, and pressure governments to act, although slavery and slave trading did not disappear completely. The key judgment is this: the League's humanitarian work was not perfect, but it achieved real success. It often worked through persuasion, reports, advice, and cooperation rather than force. This meant its success depended upon whether governments were willing to act.